Welcome back, my teacher and colleagues, to the second part of seminar, which is diagnosis of halitosis. Proper diagnosis should be started by obtaining proper information from the patient. Consultation should be started with a thorough questioning about breath malodor, eating habit, and medical and dental history. This can be done by questionnaire or orally. The patient should be asked about halitosis, which include the frequency of halitosis, the time of appearance during the day, when the problem first appeared, and whether the problem identified by others. Oropharyngeal examination. The oropharyngeal examination includes inspection of deep caries lesion, interdental food impaction, wounds, bleeding of the gums, periodontal pockets, tongue coating, dry mouth, and tonsils and pharynx. Tongue coating can be scored with regard to thickness and surface. Several methods have been shown to propose for thickness. For example, Gross and co-workers in 1978 thus proposed an index ranging from 0 no coating to 3 severe coating. Second, Miyazaki scoring system. The Miyazaki tongue coating index score include 0 non-visible, 1 less than one-third of the tongue have been covered, 2 less than two-thirds of the tongue covered, and 3 more than two-thirds of the tongue have been covered. Third, Winkel and co-worker scoring system. The coating index divides the dorsal surface of the tongue into 6 areas, 3 in the posterior and 3 in the anterior part of the tongue. The tongue coating in each sextant is scored as 0 no coating, 1 light coating, and 2 severe coating. The medical history includes the patient should ask if he taken any medication, if he had any systemic disease, or he have a history of ENT. Also, the dental history should be asked the patient, which include the frequency of dental visit, use of the mouth rinse, the presence of any dental prosthesis, and the frequency of the tooth brushing. Halitosis measurement. This can be done either by direct or indirect method. The direct method include self-examination, other people notice, organoleptic measurement, chemical sensor, gas chromatography, portable sulfate monitor, and pocket tester, while the indirect method include salivary incubation test, dark field contrast microscopy, polymerase chain reaction, electronic nose, and chairside method. Firstly, direct measurement. Self-examination. Smelling one's own breath. This can be done by tongue swab, smelling a toothpick, smelling saliva spit, liking the wrist, hand cupping or mouth cover method. For example, when the patient liking the wrist, subjects are asked to extend the tongue and lick their wrist in a perpendicular fashion. The presence of odor is adjusted by the smelling the wrist after 5 seconds at a distance of about 3 cm. However, this measurement of oral malodor is unreliable and should be careful with such information obtained from the patients. Organoleptic method. This measurement is considered the gold standard for halitosis measurement. It involves using the human nose to score the intensity of odors emanating from the patient's mouth at varying distances. Testing should be undertaken in the morning before eating and hygiene procedure performed for obtaining correct measurement of the condition. Corneal malodor can be detected by the intensity scale of Rosenberg. This scale includes 0. Odor cannot be detected, 1. Questionable malodor, 2. Slight malodor, 3. Malodor is definitely detected, 4. Strong malodor, and 5. Very strong malodor. In organoleptic assessment, the judge smells a series of air samples as follows. Nasal breath udder. The subject expires through the nose while keeping the mouth closed. When the nasal expiration is mal-udder, while the air expired through the mouth is not, an ENT problem can be suspected. Second, oral cavity udder. The subject opened the mouth and refrained from breathing while the judge placed his or her nose close to the mouth opening at about 5 centimeters from the patient's mouth. Third, oral cavity udder. The patient counts from 1 to 10. This provides oral mal-udder because of drying the palatal and tongue mucosa. 4. Tongue coating. The judge smells a tongue scraping from posterior part of the tongue, obtained with an udderless plastic spoon, at a distance of about 5 centimeters from his or her nose. This udder resembles that emanating from the posterior surface of the tongue. Before organoleptic assessment, the patient instructed for avoid any onion, garlic, and any of fibrous food or liquid in about 48 hours. Also, avoid oral hygiene measure for 8 hours in order to provide accurate diagnosis. Disadvantages of organoleptic method. The main disadvantages include: firstly, the don't preferred by the examiner. Second, uncomfortable position for the patient. Third, the patient needs to avoid fibrous food or liquid for 48 hours. 4. The use of panel judge. However, this provides an improvement in the reliability of the result, but this causes an increasing in the cost of the test. Portable volatile sulfide monitor. The halimeter is an electronic device that detects the presence of volatile sulfur compounds such as hydrogen sulfide and methyl mercaptan in breath. It provides an objective measurement of halitosis. In this measurement, electrochemical reaction with sulfur-containing compound generates an electrical current that is proportional to the concentration of the volatile sulfur compound. Using a recorder or specific software, a graphic presentation can be obtained, which is called a halogram. This provides the response as a function of time. For obtaining optimal result, the manufacturer performing 3 measurements and using the average value. Between measurements, it's important to allow the meter to restabilize before repeating. The monitor needs regular calibration and replacement of the sensor biannually. The most common advantage and disadvantage of halimeter include: the advantages of halimeter that the ease of the use in generating quantitative measure of volatile sulfur compound chairside, while the disadvantage is that inability to measure dimethyl sulfide accurately. Also, the presence of compounds like alcohol and phenol compound can interfere with the readings. Gas chromatography. This device used for measuring volatile sulfur compound have become more popular. It separates and analyzes compound that vaporize using a gas chromatograph with a flame photometric detector. This gives the ability to distinguish between different compounds that cause halitosis. However, these devices are very expensive and require a trained personnel. Oral chroma. It's a recently portable gas chromatography that used for measuring the major oral gas component with a high perception. It's a small, portable gas chromatograph which used in the periodontal clinic. It has the capacity to measure the concentration of the 3 key sulfur compounds, include hydrogen sulfide, methyl mercaptan, and dimethyl sulfide separately. That can be helpful for differential diagnosis. See how the oral chroma will be working.
Okay, now I'm going to open up the oral chroma and I'm going to inject into the oral chroma. It takes about 4 minutes to get the results. After we injected the gas into the oral chroma, now what's happening is it's receiving the data and it's giving us the measurement in the computer, and after about 4 minutes when it's done, then we'll go to the judgment part, which is here, and that will tell us exactly the amount of bacteria from, which is producing the gases that our patients have. The chart is giving us a demonstration as whether or not our patients have halitosis or not. There's three color indications. The yellow, we call the cognitive threshold, is where it's from the high to the low end. If you're below the yellow, then you're safe. Then if you do have any type of odors, it's not noticeable by the human smell. If you're in the pink zone, then it would be definitely noticeable to the human smell. And anything in the yellow, of course, we know it's not going to be noticed. Gases that it's portraying is hydrogen sulfide, methyl mercaptan, and dimethyl sulfide.
Well, by comparing the Halley emitter versus the oral chroma, the Halley emitter is easily to handle, affordable, display results immediately, cannot discriminate among different gases, and maintenance need. While the oral chroma, easily to handle, more expensive, take about 4 minutes for dimethyl sulfide and 8 minutes for methylmercaptan before measurements are shown. Can be discriminate among hydrogen sulfide, methylmercaptan, and dimethyl sulfide. Also maintenance needs. Chemical sensor diamond probe. It's a currently alternative method used for measuring the compound directly inside the periodontal pocket and dorsal surface of the tongue. This measure provides a demonstrated result very comparable to the organoleptic reading and gas chromatography measurements. Pocket body breath tester. These devices are recently used for testing the body breath. They are easy to be used and there are many types of it. For example, this test, its scores are very good, normal, not so good, bad, and very bad. The second method for measuring the halitosis are indirect measurement. There are a number of indirect methods for measuring halitosis. For example, saliva incubation test. Saliva samples are incubated in a sealed container at 37 degrees centigrade, and the headspace of the container analyzed for volatile sulfur compound, either by gas chromatography or organoleptic evaluation. This method provides an accurate measurement when compared to the organoleptic method. Dark field or phase microscopy. Gingivitis and periodontitis are typically associated with a high incidence of multi-organism and spirochetes. So shift in this proportion allow monitoring of therapeutic progress. Another advantage of direct microscopy is that the patient becomes aware of bacteria being present in plaque, tongue coating, and saliva. Chair-side test. A salivary chair-side test may be used as an alternative method for diagnosing halitosis. Currently, several tests based on the detection of bacteria and metabolites involved in the process of oral malodor. For example, PANA test. This test is based on the ability of some bacterial species to hydrolyze synthetic trypsin substrate and benzoyl D-L-arginine 2-methylamine. In this way, the test can detect three bacterial species related to the periodontal disease: P. gingivalis, T. denticola, and Bacterial foetidus. The second test is beta-galactosidase. The level of enzyme beta-galactosidase have been found to correlate with oral malodor. The first step in the formation of halitosis is the glycosylation of glycoprotein. The activity of this enzyme can be assessed by affecting on the chromogenic substrate on the chromographic paper. When saliva comes in contact with the paper disc, a color change is detected on the paper according to the amount of enzymatic activity. Another example is non-hydrogen test. This method is based on the detection of low molecular weight amine and polyamine that cannot be detected using the sulfur monitor. When this method is used, the isopropanol is mixed with the sample taken from the patient and then centrifuged. The reading is light permeability using the spectrometer. This method is fast, easy to be applied, and inexpensive. Electronic nose. An electronic artificial nose that identifies the specific component of an odor and analyzes its chemical makeup. It consists of a mechanism for chemical detection, such as an array of electronic sensors and a mechanism for pattern recognition. This device is smaller, less expensive, and easier to be used when compared, for example, to gas chromatography. But this can be developed only for specific application if the metabolites are already known. Polymerase chain reaction. PCR reaction is rapid, sensitive, and specific diagnostic technique which have become an important and popular detection system in recent years. With using the PCR, a quantitative analysis of the microorganism causing the volatile sulfur compound from the oral specimen, such as saliva, tongue coating, and subscriber plaque, can be performed.